CPR. Let's learn how to do CPR using the AED. Now, CPR stands for cardiopulmonary resuscitation. Your job is to pump the heart because the heart has stopped working. You need to pump the heart, which pumps blood around the body, and inside blood we've got oxygen. As well as doing the compressions, we must also do 2 rescue breaths. We do 30 chest compressions and 2 rescue breaths. And we keep on going until somebody takes over. Okay, let's remind ourselves of the primary survey. The first thing we must do is check the area for danger. We then check for response. We shout for help if they do not respond. We open the airway. We look, listen and feel for breathing for 10 seconds. And if they're not breathing normally, we begin CPR. Let's put all that into practice now. Okay, so first thing we do is check the area for danger. Make sure it's not dangerous for me to be able to approach the casualty. We then check for response. We tap their collarbone or we pinch their ear. We also give them a command such as, "Can you open your eyes for me? Are you okay?" If they don't respond, we shout for help as loud as we can. We then open the airway by doing a chin lift and head tilt. This is crucial because what you're doing is moving the tongue out of the way, which could be blocking the airway. We then look, listen and feel for normal breathing. So we're looking at their chest rising and falling. We're feeling on our cheek for normal breathing. And we're also listening to see if they're breathing normally. Now, breathing normally for an adult is between 2 and 4 breaths in 10 seconds. If they're gasping for air, making noises like that, this is not normal breathing. We call that agonal gasps. You need to perform CPR to this person. So after you've checked their breathing for 10 seconds and you know they're not breathing normally, you must call 999. You must also go and get an AED if you know there's one locally available. That might mean you leaving your patient or you sending somebody else to go and call 999 and getting that AED for you. If you are by yourself, you can put 999 on speakerphone. If you know there's an AED nearby, then go and get it and come back and treat your patient with it and just turn it on and follow the instructions. For the purposes of this video, we're going to assume you've got an AED at your local reception desk. So you've gone to go and get the AED, you've come back. The very first thing you must do is turn it on. Then you must get the scissors and you must remove the clothing from the casualty and then just simply follow the instructions on the AED. It will talk its way through everything for you.
Apply pads to patient's bare chest.
Now remember, it is the patient's bare chest, so this is when the razor might come in handy, the scissors will in order to remove the clothing, and also the towel in order to be able to dry the patient's chest if they've been sweating or they're very clammy or maybe it's just wet outside. Please take your time and look at the pictures on the pads. It tells you very clearly where to place them. The first one must be placed on the patient's right collarbone. The second one is then normally on the patient's left hand side. Now this allows the electrical shock to go through the heart. You must make sure when you put the pads on, they are to a naked chest. They're not over the top of any jewellery or any patches, and there must be a hand's width distance apart between the 2 pads. Now when you're happy with the pad placement, remember as soon as you put them on you can't remove them, then just follow the rest of the instructions on the AED.
Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient.
Now when it's analysing, what it's looking for is a shockable rhythm. It will not shock somebody who has a normal heart rhythm like you and I. It will also not shock somebody who is flatlined. It will only shock certain rhythms, and the most common one it will shock will be someone suffering from VF, which stands for ventricular fibrillation, where the bottom 2 chambers of the heart are going into spasm. So rather than beating normally, they go a little bit crazy. So they need a shock, and the shock will kill the heart, and then the heart's internal pacemaker will then start beating normally again. Now the AED will either say shock advised or no shock advised. If it says no shock advised, then all that might mean is the person has a normal rhythm, or it just means they haven't got a shockable rhythm. Unless the person's sitting up talking to you, carry on with CPR. Now if it says shock advised, follow the instructions on the AED.
Shock advised. Charging. Stay clear of patient.
Now as it's charging, keep your finger over the shock button. Pay attention to the casualty. Make sure nobody is touching the casualty. And when it says deliver shock now, push the button, but make sure nobody is touching that casualty.
Deliver shock. Shock delivered.
After the shock has been delivered, it is then safe to begin CPR again, and you carry on with 30 compressions to 2 rescue breaths.
Start CPR.
And you keep on going with 30 compressions, pushing down at least 5 to 6 centimeters in depth at the speed of 100 to 120 compressions per minute. 30 compressions to 2 rescue breaths. You keep on going until somebody else takes over. Thank you for watching. I hope you really enjoyed the video. And if you did, please don't forget to like and subscribe to our channel, where you can receive lots more videos on really important and life-saving first aid skills. Thanks very much. Have a nice day.